Very good morning, everyone. My topic is on the preoperative versus the intraoperative subconjunctival C role in preventing the pterygium recurrence. First of all, moving towards the introduction, the pterygium is a wing-shaped fibrovascular conjunctival growth associated with the UV exposure, dust, wind, and dry climate. Recurrence after the surgery remains the major challenge, where we can use various interventions such as the conjunctival autograft and the mitomycin C, which used to reduce the reoccurrence. Aims and objective to compare the role of the preoperative versus the intraoperative subpterygial mitomycin C injection in prevention of its recurrence, where the primary objective is to evaluate the efficacy of the mitomycin C, and the secondary objective is to study the demographics. The hypothesis, where the null hypothesis says that efficacy of the preoperative mitomycin C subpterygial injection 1 month prior to the surgery in preventing the recurrence is same as when compared to the intraop, whereas the alternative hypothesis says that it is more or less there is a difference between the two. The inclusion criteria includes that age more than 18 years, all the patients with a primary pterygium who have given the written consent, and the exclusion criteria includes any pre-existing scleral disease, any patient with the anterior uveitis, anterior or posterior cephaloma, any intraocular surgery within recent 1 month. Methodology is that my study is about the prospective randomized control trial, where we have taken the 78 patients and divided them into the two groups. Group 1 is with the intra-op MMC injection 0.15 mg per ml for 2 minutes plus bare sclera excision, where the group 2 is the preoperative MMC injection 1 month prior to the surgery, and then we did a bare sclera excision, and the follow-up was done on the post-op day 1, week 1, and first and second and third month. The same as we have seen the flowchart, that the complete ophthalmological record has been recorded on the very first visit after the informed consent is taken, and the patient is divided randomly divided into group 1 and 2, and the post-operative follow-up day 1, 7, and month 1, 2, and 3, we do a comprehensive ophthalmological examination again, and we analyze the data. Results, the recurrence rate at the 3 month in the intraoperative MMC, it was 7.7%, while in the preoperative, it was 10%. So there is no statistical difference between the two. The age distribution is very comparable, and the post-operative complication, as we can see that in the intraoperative group, it is in the 20 patients out of the 80 patients, and in the preoperative group, it is only into the 10 patients. Frequency of the complications, we see that there is redness almost among the 10 patients, and scleritis among the 3 patients, and limbal stem cell deficiency among 2 patients, 1 patient with the dry eye, 1 with the granuloma, and 1 with the Dellen. All the complications were seen in the group 1, where we have given in the intraop MMC and bare sclera, while in the group 2, few only dry eye, only redness and scleritis has been seen. As discussion part, we see that both the preoperative and intraoperative MMC reduce the recurrence efficiently. Preoperative groups show fewer complications, while the findings were consistent with the published literature. My limitation is that it is a short 3-month follow-up with a single center and small sample size. In the conclusion, both the MMC approach are safe and effective in prevention of the recurrence. Preoperative injection may offer a slight advantage, and in the future, long-term multi-center study is recommended and can be used as an adjunct treatment to this. Thank you.